Well, it took nearly 2 months in the hospital, more than $800,000 in medical bills, and at least 100 care providers to get an Oregon child back in good health after he was diagnosed with tetanus. He got sick back in 2017, but we're just now getting details on this case from the CDC and hearing from the doctors who treated him. Fox 12's Audrey Wheel is live tonight at OHSU. And Audrey, what are those doctors saying at this point?
They say it's amazing that this 6-year-old boy not only lived, but made a full recovery. Now, this is the first case of tetanus in Oregon in the past 30 years. And tetanus is extremely rare in the United States because the vaccine is so common. But because it's so rare and because this case was so severe, even the doctors had a hard time with it.
We had a hard time taking care of this child, watching him suffer.
In the summer of 2017, a 6-year-old boy from Oregon spent 57 days here at OHSU Dornbeckers for treatment of what doctors tell us was a severe case of tetanus. A new report from the CDC details what happened. It says the child had no immunizations when he cut his forehead while playing outside on a farm. The cut was cleaned and stitched at home. Then about a week later, he experienced jaw clenching, muscle spasms, and difficulty breathing, among other serious symptoms. Doctors diagnosed him with tetanus, which is essentially a poison to the nervous system. It's a bacteria found in dirt and often in the intestines of animals. In humans, it can be deadly. The little boy spent most of his nearly 2 months here in the intensive care unit on a respirator.
He couldn't speak because of the lockjaw, but he looked like he was in a lot of pain.
Doctors Carl Erickson and Judith Guzman-Catrill are two of at least 100 care providers who treated the child. They say it was a challenging case for a few reasons. One, how uncommon it is.
Very few physicians in the U.S. know how to manage tetanus because it's so rare.
They had to rely on colleagues and literature from developing countries to come up with a treatment plan. And two, because they say it was hard to see this child suffering, especially from a preventable infection.
There is certainly a level of frustration there. But, you know, it's when we have cases like this where we aren't sure if they're going to make it and then they do, it's a wonderful ending to the story.
They're not telling us the name of that patient for his privacy, but in all, the hospital bills added up to more than $800,000. He did receive a tetanus shot here at the hospital, but the family declined a second dose of that vaccine. Live at OHSU, Audrey Wheel, Fox 12 Oregon.